Hello. Good afternoon, Sérgio. Good afternoon, Cassyano. Welcome, and welcome to everyone who is watching. It is always a pleasure to discuss health, mostly in a moment where health has become front and center for everyone in the world and also for Brazil. Sergio, I think you could begin, Sergio. You have more than 20 years of experience in the pharmaceutical retail sector. Can you tell us a bit about the sector in Brazil and about this culture that we have of going to a drugstore, to a pharmacy? Can you give us a bit of a historical background? Well, good afternoon, everyone. It is a pleasure to be here with this amazing audience. I know that over 20,000 people have registered to watch the FIS week. This is an amazing event, mostly in a moment such as the one we are living right now in Brazil. Health has never been such an important topic. It's not that I have 20 years of experience. It's actually 32 years of experience. And these 32 years, I've never seen, every day we have health being in the highlights of newspapers. Of course, we are going through a sad moment of the pandemic, many deaths, people questioning decisions that were made. But I believe that, finally, for one reason, although not a very good reason, health is finally in the spotlight. And health is a topic for all of us. People now know what comorbidity is. People know what is an acute patient. People know labs by names. People have learned to pronounce the names of different pharmaceutical companies. The world will not be the same after this experience. And I think that the awareness about the importance of health is very clear. And here at Abrafarma, we have been aware of the importance of health for many years. We take health into people's homes. It is because of the pharmaceutical industry and because of the services that we provide directly to patients. After a patient has an appointment with a physician, they finally buy medication, and we take quality of health to people's lives, longevity. We decrease the chances of disease, and we are aware of the importance of the role of pharmacies and drugstores. We have 80,000 pharmacies and drugstores in Brazil. We know a lot of drugstores open every day, and whenever you see a new Abrafarma is an association that represents the 26 largest networks of pharmacies and drugstores in Brazil. Whenever you see a new pharmacy that's recently opened, and that's just like the ones that we have in developed countries, that's where you will find excellence in services and a lot of competence, and maybe filling the gap that was left by an institution that did not have all the same experience. And I think this is positive. The more qualified pharmacies and drugstores that we have, and pharmaceutical professionals, better for the population. I wanted to give you two figures. Abrafarma has 43% of the whole Brazilian market of beauty products, hygiene products, and pharmaceutical products. 40% of this market go through 1,600 stores. So we have 10% of the pharmacies, but we have almost half of market share. And we do millions of services. It's as if the whole Brazilian population went 4 times into these thousands of pharmacies that have an excellent structure and that are very well qualified to bring the best possible pharmaceutical services for all Brazilians. We are very proud of everything we've built. Abrafarma is celebrating its 30th anniversary this year, and I think we are in an excellent position. We are proud of the work we do, and we are proud of the pharmacies that we have around Brazil today. Great, Sergio. Yes, it's actually a golden standard. We know that pharmacies from other countries come to Brazil to see how we work here. Cassyano, Sergio talked about service. What are the services provided in a pharmacy before the pandemic and now after the pandemic? What has changed? Well, good afternoon, Renato and Sérgio. It's a pleasure to be here with you in this very important event. Well, looking back, we have the big picture, and we have to consider that, you know, we are going through a demographical moment in Brazil where populations are aging. And in Brazil, this is also happening. With an aging population, we have a higher prevalence of chronic diseases. There is an epidemiologic transition connected to this phenomenon. And this is connected also to quality of life. People are living longer. And that brings greater consumption of medication. The amount of people that take 2, 3, 4, sometimes 10 medications a day, you know, to preserve their health and to increase their life expectancy is higher. And also we have to consider technology, not just in medication in the pharmaceutical sector, but also in diagnosis, software, hardware, Internet of Things or IoT. They all allow us to do health assessments that we could not do 20 years ago. Health information about these patients can move around in a easier way. We have eliminated paper, and it's now all digital. So because of all these changes, we have to think of a new pharmacy or drugstore. In Brazil specifically, legislation has been historically stringent on what pharmacies could do. 20 years ago, we could not measure blood pressure in a pharmacy. I know this sounds unbelievable today, but it is true. So if you want to help someone who has high blood pressure, you could not do this in a pharmacy. And we had pharmacists, professional pharmacists available, and they could not conduct these procedures 20 years ago in a pharmacy. Fortunately, this has changed. You know, now pharmacies can do many things they couldn't. Of course, we can still, there's still a path to be followed. In 2014, we had an act that was passed, and it changes the nature of pharmacies in Brazil. Now they are seen as health services providers. And from that point on, pharmacies have the legal safety to finally provide more services. In general terms, what are the services that we provide in pharmacies? Well, we have basic health attention, primary health services, services connected to the early identification of risk. So a quick test of dengue fever, for instance, if you have symptoms, or now with COVID, and if the test is positive, the person can then be referred to a physician. So prevention is a key service in pharmacies. Then we have services for people who already have a diagnosed disease, a person with diabetes or with high blood pressure. We can follow up on the evolution of the disease and in the control of the disease. We can help the patient's journey. Then we have vaccines, which is also connected to prevention and health promotion services. So it's a broad range of vaccines that we can currently make available in pharmacies. And also services connected to the pharmaceutical, the health professional who has a university degree, sometimes even a master's. And we have one of these professionals at every pharmacy. Putting all of this together, we have pharmacies that are a place where people can purchase medications, drugs, and other health-related products, but they are also a place that has become a reference for families, for individuals, in a way that is very much connected to the rest of the health system, to the physicians that serve these patients. And we are connected also to nutrition experts, psychologists. So pharmacies are now present in the population's everyday lives. Yes, thank you. I think we can, of course, say that the pandemic brought different challenges, right? What has changed? You have already said that the pandemic accelerated many changes. What has the pandemic accelerated in pharmacies? How have pharmacies changed throughout the pandemic? It's an excellent question. Yes, the pandemic did accelerate some changes. Pharmacies had to respond to many needs of the population. First, we had to deal with people's fears. Then we had to deal with the need to have answers to citizens. Just look how crazy the beginning of the pandemic was. People were trying to buy masks, hand sanitizers, medications. I remember in early March last year, we needed to supply the stores, and we had no shortage of supplies in pharmacies. So 2020 and 2021, they represent the pinnacle of our work. In recent years, we were preparing for something that we could not fathom that would come, which was the pandemic. If I was training people how to learn how to deal with crisis, how to deal with a retail sector in a crisis, 2020 and 2021 were 2 years of huge learning. In spite of all the negative aspects, it has been a pleasure to go through this challenge, to go through this war that we faced in these last months. And we had to solve some pent-up demands. We are a highly regulated sector, as you know. The health sector is usually slow in general terms because there's a lot of bureaucracy, and we needed to fight bureaucracy. And I have to say that the federal government did respond to all of our demands in the beginning of the pandemic. Myself, Cassyano, and you yourself, Renato, Francisco as well, the government did respond to our questions and our demands. And we now have telemedicine, electronic medical records, integration with apps, with different platforms. So we can, and besides everyday operations, which are already very well designed, we were already undergoing a digital transformation before the pandemic. We were already integrating different channels. Something that the population in general does not know is that currently in our industry, we have a dark store. It's a store that is not open to the general public. Many chains of pharmacies have dark stores. They are like mini distribution centers, mini hubs, and their role is to ensure that the delivery system works in an agile and correct manner. So in e-commerce, we had 500 million, and we moved to 1 billion. And now we are in 2 billion reais in this industry. So it was a growth of 100%, and we will grow an additional 100% until the end of this year. And this is because we are responding to customers' needs. Another very interesting thing that we could achieve, and it was a demand from society, is quick tests. And I think that Cassyano can comment on that. Pharmacies were never as close to the population as we became during the pandemic. We were close to the population, of course, before the COVID pandemic. But throughout recent months, people came to our counter saying, I'm afraid, my mother is sick, my husband is sick at home, and I don't know what to do. And pharmaceutical professionals You know, they had the answer. They supported this population. Oftentimes, they referred people to the health system because the person would not acknowledge the severity of their own situation. So it was like a crash PhD course on everything we had prepared ever since the act was enacted, the one that Cassyano mentioned. So we are at a different level right now as pharmacies. You know, we did our homework. We faced a very difficult situation. Many pharmacies said, no, I don't want to work with quick COVID tests. I don't want to get involved with the pandemic, but this is unavoidable. You know, we were in the front of a war. It was a battle, and we are coming out of this stronger. Health professionals, pharmaceutical professionals, and even people who work in the cashier, you know, they deserve a medal in their chests because they are stronger now. They know the importance of the roles that they play. Yes, we do see that pharmacies have become a shelter for the population. You know, people could go to a pharmacy and ask questions and solve their questions. Pharmacies are spread all around Brazil, over 80,000 pharmacies around Brazil. Cassyano, I guess you have the icing on the cake in your hands right now. Tell us about the quick COVID tests and pharmacies. How was that work? Can you give us some figures? Can you talk about you know, the commitment to ensuring the quality of these tests and how the tests evolved throughout the pandemic? You know, it's been almost 2 years or more than a year that we are doing these tests, quick tests in pharmacies. Yes, exactly. In March last year, when the pandemic hit Brazil, we already had the first tests. They were antibody tests, which were criticized back then. And in April last year, with Abrafarma, we were already working on a protocol to guide pharmacies on how they could provide the test, not just test protocols, but also safety in the flow of customers and decreasing the risk of contamination of the professionals who work in pharmacies. Anvisa, which is the Brazilian FDA, they authorized the execution of quick COVID tests in pharmacies last year. And just in the following day after receiving this authorization, we already had Abrafarma pharmacies conducting these tests because they were prepared. And the rest is history. We had different stages of the pandemic, different moments. We had a peak late last year, as you remember. Then we had a higher peak in March this year. And in the last 100 weeks, we've had in which pharmacies have conducted these quick tests. We are following up on these tests. Over 11 million quick COVID tests. Millions of patients were served all around Brazil from different age brackets. The most common test is the antigen test. It's the one with the swab. It's the nasal swab test, and we can provide the results in about 10 minutes, and we can give the results to the patient in about 10 minutes. When the result is positive, we can refer patients to a physician, whether they have to go to a physician immediately, depending on the symptoms, or if they can go home. We have a set of structured questions that the pharmacist asks patients. So we have this very safe protocol. The quality of tests, which was questioned for a while, but with time, the market solved this issue. And pharmacies, although we have hundreds of different quick tests registered in Brazil, pharmacies actually worked with a restricted number of tests from about 10 or 15 different providers, precisely because of the severe qualification process of these test suppliers. The tests were validated through assays in laboratories in Brazil, reliable laboratories. So there was a huge concern. We did not want to go wrong. And we had to face a surge in demand pharmacies scheduled these tests, most of them. We created online scheduling systems so that we could serve the demand and avoid too many people in pharmacies at one. We had tents outside many pharmacies in a drive-through system, and pharmacies were working round the clock at night, sometimes even, at dawn. We had 24/7 services in pharmacies. And in spite of these figures, 11 million tests, the capacity to serve from our pharmacies is amazing. This is something we are looking at. In spite of the surge in demand, pharmacies had 60% of their capacity to serve occupied. And what do I mean by that? Well, whereas other sectors of the health system, mostly hospitals, were overwhelmed and almost collapsing because of high demand, pharmacies did meet the demand of the population. They managed to serve patients, and they were not overwhelmed. They were far away from a collapse. Quite the opposite. Pharmacies had capacity to serve if it was necessary, to serve more people. And still speaking about quick tests, yes, COVID is the icing in the cake, as you said. Our current technologies allow us to conduct over 30 different quick tests. We have different types of technologies coming from different countries. We have readers that conduct very complex exams such as cholesterol, diabetes, prostate exams, specific antigens, beta HCG, which is a blood test to test for pregnancy. Women can do that, and they can start their prenatal follow-up immediately. And also a gamut of quick tests for infectious diseases or contagious diseases such as COVID. We already had this in Brazil in the public sector for HIV, dengue fever, chikungunya fever, hepatitis. All these quick tests are already conducted in many pharmacies. And many people sometimes have symptoms, but it's hard to identify what's the disease. They go to a pharmacy searching for a drug for that symptom, and the pharmacist may then refer the patient to a physician to reach a more precise diagnosis. So quick tests is an area that has a lot to grow, but I think that the important part is that the Brazilian population has discovered they can count on pharmacies, not just as a place to buy medication, but also to take tests, to do exams, and to search for the help of our pharmacist at accessible prices.
I think both you, Sérgio, and you, Cassyano, what you both said really reiterates the commitment of healthcare with pharmacy and also the commitment to transformation. It's important to prevent. It's important for people to be careful in that regard. And quick tests can be an important tool in the early diagnosis, which certainly decreases the healthcare costs and any harm to the population. So, has it changed? We are leaving the pandemic behind, hopefully. So, what can we expect, Sérgio, in terms of new services, in terms of not only a new pharma industry, but in terms of what we can make available to consumers? Can we think that these legal barriers are now a thing of the past, and we're moving towards pharmacies being able to provide primary care to consumers and patients? I believe so. We're talking about a new pharma industry, a modern one that has no shortage of products, with a room dedicated to pharmaceutical services, with highly qualified professionals that are deeply aware of their role in the healthcare system. But we're lagging behind, Renato. It's been 20 years, if I remember. It was the first year. I've been at Abrafarma for 21 years. I went to pharmacy in Spain and I saw a device there, a Refertron for a venal puncture. And there was a mini lab in their store. It's been 20 years, and 20 years into the future, we're still discussing about how to bring point of care to pharmacies. So the law allowed us to make some progress in 2013, but now we have to take another leap. We have taken a leap forward, but we really have to advance now in terms of quick tests and other possibilities that pharmacies can offer. I know that we are now in a disruptive era. This morning, I was in a telemedicine panel, and Eduardo Cordioli from Einstein was giving us examples of how service is happening remotely in locations where it would take us 5 days to get to by boat. Maybe the person has a heart attack or any other problem. Who should they resort to? We have over 1,000 municipalities in Brazil with little or no medical assistance. I am from Ceará, and the main investment that the municipality does is to purchase new ambulances to take patients and take them to the closest clinic. And it's in these locations that telemedicine, it's them that they're going to help. And it is in pharmacies that telemedicine can be useful and help pharmacists provide the emergency care to patients that have no one to resort to in their cities. And it's not only in small cities that I'm talking about, but in mid-sized cities too. We know that our system is, well, it's not that it's inadequate, but it's unfair. Some people have more access, some people have less access, and pharmacies can very well contribute to that, to improving that situation and curate diseases and help patients that have now expanded their awareness about their health conditions during the COVID-19 crisis. Now they're going to be empowered to take better care of their health. I always like to give the example of my mother-in-law, and she could be taking care of the disease with the support of pharmacists. So we have we have room for improvement. We can use quick tests and other tools where pharmacists can be the longomanus of physicians and help them take good care of patients. And also to have patients take better care of their health, like my mother-in-law, when she goes see her doctor and he tells her that, well, your triglycerides are at 380 again. So since since health has become the center of our lives during the pandemic, it is our role to transform this into a leap forward. And in that regard, pharmacies have a fundamental role. The possibility of doing quick tests and bringing more technologies to pharmacies and becoming more integrated into the healthcare system, and probably having a physician at pharmacies seeing patients through telemedicine. And we have to look forward and think that as a country, we can achieve much better results in terms of healthcare than the ones that we've been achieving so far. This is our challenge, and we have 8,600 pharmacies. Very soon, we're going to have 9,000, 10,000, and they're all going to be available to the population to improve healthcare as a whole. That's great. Well, Sergio, you actually answered a few questions that I was going to ask you. But before we do that, Cassyano, what does maintaining service quality entail? It's very important to tell the population. I know that Abrafarma has a training program. You coordinate several activities. So how do we maintain the current services at pharmacies, a precise, accurate services? Thank you for your question, Renato. Well, there's two basic aspects. The first is training human resources or working with pharmaceuticals as healthcare professionals and giving them more possibilities to get trained and updated in their skills about these new services and technologies that are emerging. Obviously, we're talking about professionals that went to medical school, but 15 years after their graduation, the world's changed a lot. And we have to retrain these professionals. And that's fundamental if we want to maintain quality of care. The second thing is protocol and standardization. Healthcare requires us to standardize everything, whether it is procedures or a step-by-step of a medical history with the patient, the way you deliver test results to patients. I mean, there are clinical guidelines and there's science behind that, and that has to be followed if we want to achieve a certain standard of quality in our care. And with that, to be able to maximize and to improve the health outcomes that we deliver to our patients. So there's these two sides to it, training professionals and standardizing protocols. The advanced program in pharmaceutical training of Abrafarma, as other initiatives in Brazil, is based on these two pillars, in addition to the outpatient setting, discussing the regulatory aspects. But as a routine, pharmaceuticals can count on that support so that we deliver healthcare that is not something minor or something not as accurate. Quite the opposite. It follows international standards and it's up to par with other services anywhere in Brazil or the world. Well, I think that's a huge challenge. We do have regulatory hurdles ahead of us, and we're going to have to work to overcome them. Sergio, I'm going to merge two questions. The pharmaceutical teleconsultations, are they a reality in Brazil? And is telemedicine already available at pharmaceutical offices? You said that you were participating in a panel this morning. Is that a reality? Well, we have some incipient initiatives. That's not yet a reality. That's still being tested, but that's possibly a product that needs some advancement. It does not replace pharmaceuticals and in-person visits, of course not, but it could be added to in-person services and cater to an existing demand. We have, somebody was telling me today, there was an interview that I was participating in. I think it was Mussolini that said that, well, when the popular pharmacy was created, Abrafarma had to place seats at the stores to meet the demands, and pharmaceuticals are under a lot of demand nowadays. So yes, telemedicine along with pharmaceuticals, well, that's a reality. And this pharmacy of the future, that involves those procedures, I would say. Cassyano, do you think that we'll eventually have only pharmacists seeing patients in pharmacies? Well, there's a story that I probably never told when I graduated and I went to Curitiba, and during my first years in pharma and drugstores during my first years, I was working at a pharmacy where there were only pharmacists. Actually, it was 6 of us working in a small pharmacy that saw lots of patients from healthcare plans, and we provided a series of services back in year 2000. And we also vaccinated people with the flu shot in 2001. And then there came an ordinance that banned that practice and I was one of the pharmacists that was forbidden from vaccinating people with the flu shot. So I don't think that's really the way forward. Having only pharmacists, we should have well qualified technicians, as is the case in other countries. We're going to see different services of different complexities being offered. The pharmacies and their desks need to continue to exist, and pharmacists, if they're able to supervise, of course, they're going to be supervising the other employees, but they won't be able to see each and every client in the store. It's never been like that and never will. I think there'll come a point where we will have to seriously discuss the profession of technicians in pharmaceutics in Brazil, because, well, that'll be a good thing for the population in Brazil, but that is a discussion that's still a bit out there for now, I would say. Well, thanks. We're coming to an end with our panel, but one other thing I'd like to say is that we all like to care for people and to take good care of them. Would you say that this will imply any changes to the cost of healthcare? I know that we started out with tests at a certain price. Now the price is different, and now if we compare them with quick tests, they're cheaper. So would the cost change? Can patients go to a pharmacy and expect cheaper services? Yeah, that will change for the better. It will become more accessible and cheaper as well, for sure. And I said this morning, this will always be a high-tech market, but also a high-touch market. We're going to have telemedicine and channel and everything else, and people will be looking at their smartphone screens, but it's the human touch that differentiates the pharma industry from other sectors. And this is what and this is what we're going to continue to be. And my best regards to Rodrigo and everyone from FIS. Cassyano, a final statement, please. I just want to thank you. That was a very good conversation. Congratulations on a great event. Thank you very much. Thank you, Sérgio. Thank you, Cassyano. I want to thank FIS. This has been undoubtedly a very special event in the healthcare agenda of Brazil, with extremely good discussions. And hopefully in the last 45 minutes, we're able to give you an idea of the new role of pharmacies in this new healthcare ecosystem, trying to anticipate problems and take society to a new and better situation. So thank you. Thank you, Renato. And congratulations. Thank you, Cassyano.